Hello, everyone. Welcome to Travel Tuesday. Thank you for joining us today. This week, we're going to be discussing American healthcare costs. So, some of the most common questions. First of all, why is healthcare so expensive in the US? How much does GHIP cover in the US? What is invoice padding? And are the bills negotiable? So, American healthcare is costly. We all know this. It's the most expensive healthcare in the world by far. There have been many books and articles written on the subject, and there are many factors to this. So, doctors are a lot more expensive, partially due to their education being so costly compared to other countries. Prescription medication is also a lot more expensive in the States, and American healthcare is completely privatized, which means the government doesn't have any control or influence over the healthcare costs. So, again, there are a lot of factors that play into this, but this is just a little sample as to why it is so costly. Now, your GHIP won't cover you. When you leave Canada, you're leaving 90% of your provincial health care behind, and your GHIP covers so little when you leave the country that it's almost not even significant enough for the insurance companies to collect. So, for example, an inpatient stay in a US hospital can cost between $5,000 to $20,000 per day, of which your GHIP will cover only between $200 to $400 of. And there are things that GHIP won't contribute towards whatsoever. Now, if you have specific questions as to what you are covered for out of your country and how much GHIP does cover, be sure to contact your provincial healthcare provider to get information as to that, as it does differ a little bit province to province. But this is the whole meaning and purpose behind travel medical insurance. You want to be covered. Next, invoice padding is a problem. So, invoice padding is when your medical bill has extra costs for tests and procedures that either never happened or were completely unnecessary. And we've seen some ridiculous charges, such as men charged for pregnancy tests, a $200 charge for a nasal evacuation system that ended up being a box of Kleenex. We've seen people given an MRI for an ear infection. We've seen another person charged $33 for one single baby aspirin. So as you can see, these charges are completely ludicrous and cause problems when it comes time for the insurance company to settle your bill. And it's one of the reasons why the bills are always negotiated, which leads us perfectly to our next point, which your bill is completely negotiable. When the insurance company receives the final bill for your healthcare, they don't simply just pay the bill right away. There is a whole process where they look into details of charges, filter out any invoice padding, and offer the hospital or facility a reasonable amount of money based on their findings. They go back and forth with the medical facility and agree upon a final price. And we can almost always guarantee that that final price is a lot lower than what the initial bill stated. Thank you for joining us this week. We're the Travel Insurance Office Incorporated, insuring traveling Canadians since 1991. Check us out online at travelinsuranceoffice.com or by phone at 1-800-550-1295. Have a wonderful week. Speak to you soon.